Hello, I'm Rita Bowen, and I'm the Vice President of Privacy and HIM Education and Policy. And I'm excited to be joining you today and talking about HIM kind of futuristically. I have been in the HIM world for the last 40 years. So it's exciting to me to see how things will be changing because I've already seen the change. So I've seen a lot of migration already. MRO, as the privacy officer, we're handling and we're specializing in release of information, and we are the class leader for the last 3 years. Primarily, we are the class leader because we have specialized in that. We don't try to put our hand in different things. We don't have our hand in different buckets. We have our hand in release of information, and we specialize in that and focus to that and give that all of our attention. Most exciting thing I see happening in the HIM world is really that HIM truly is now starting to see that whole evolution of HIM without walls. The whole enterprise HIM process and really seeing the threading. I know I was president of AHIMA in 2010, and that was part of my presentation, was that HIM needed to be threaded through everything within the organization. And you know, that's been a long time, since 2010 to now, but we're starting to see it more. You're seeing more enterprise HIM focus and more emphasis given to HIM knowledge for that whole information governance, because you know, the highest expenditure most organizations have spent on anything is their electronic health record. And they spent all this money and then it didn't come to fruition. It didn't fulfill what they thought it was going to fulfill because they didn't do the foundational work. And most of it was done without HIM. So now they're bringing HIM back in and going, oh, maybe we did need this expertise. So I think it's setting a whole new stage, and I think the whole new world of the various specializations, that we can't all just be generalists and know a little bit about everything. There has to be specialists involved. I think that's a new and exciting times. It sets a whole different level of respect within the industry. The scariest thing that I think people aren't paying attention to is how fast things are changing and how fast new technology is being introduced. And by the time they learn, I mean, I think I heard in the House delegates yesterday that they said that by the time a student graduates, learning the technology of today, when they actually hit the market, they're already behind, because the technology is changing so fast. A good analogy is like dog years. You know, you used to say, you know, a dog's life is like, 7 years, for a human year. And I think that's how fast technology is changing. It's like dog years. It's hard to keep up, and it keeps introducing things that changes the whole environment we work in. And we've got to stay aware of that and stay in tune to it so that we're taking that step mode with it. Well, I'm not a direct coder, but I can tell you last year that was the buzz because of ICD-10, and I think it was kind of like a much ado for nothing. There had been so much preparation for that process that a lot of people said, it wasn't as big a deal as we thought it was going to be. The biggest impact, I think, for I-10 was in the communication for the physicians regarding the specificity for which they need to document, and the need to continue that educational process. So those CDI programs, are going to continue. And I just heard this weekend, while I've been here at the convention, that ICD-10 will be migrating to 11 very, very quickly, probably within the next 3 to 4 years in most of the world. So the thought process that I would have is I hope it does not take our industry as long to ramp up for it this time as it did the last time, so that we can make that migration sooner because of the population health impact of having all the codes equivalents across the country. The role of HIM in the next 5 to 10 years, and I think it's already in that evolution now, there will always probably be an enterprise director that's helping thread that information throughout, but I think there's going to be more management level that own a process than you've ever seen before. I think even from a coding perspective, the coder has typically, in some organizations, sort of been behind the scenes. It's been like the person behind the curtain that makes everything happen. And I think you'll see them actually being part of a greater part of the team, having more dialogue from that perspective. So I see a greater need for communication skills and interaction. 20 years, I think that data analytics, and we keep talking about analytics, is so important, and I really think it will be actually in play in 20 years, and probably way before 20 years. But I think by having the coding information that's truly doing the analysis and having that business intelligence that can be apprised to that information, and having an enterprise record, so you're bringing in information from the physician's office, from the hospital, and actually threading it all together, it's actually going to improve the patient's care, and it's going to improve the patient experience. And I think the bigger thing is that the patient is going to be directly more involved. I know now when I go to the doctor, my doctor sits down and he starts talking to me, and then I'll go, well, now wait a minute, I've already done the research, and I need you to think about this, this, and this, and this is what I believe. And he'll go, well, then why did you come to me? And I'll go, I can't write the prescription. I need you to do that for me. But I think we're at an age now, and it's probably for me, I'm probably beyond that age, but I'm actually been exposed to it so long that I'm participating in that. But when you get your millennials, they're going to take ownership. And you're seeing more of that as people move forward. They're going to take full ownership of their own health care and not just rely on somebody else as Big Daddy that's going to help me.